let me introduce my sir. What you are telling, team. My pivot in my sleep team, pulmonologist, gestrinician friend, Dr. Arup Halder. So, Arup, you are going to talk on interpretation of PSG. And keep it in mind, we are all many surgeons over here also. We don't know almost anything about PSG.
So I am Dr. Arup Halder. As a scientific chair of this conference, it's my privilege to welcome you all to Calcutta Sleep course. And I think all of you have seen how a PSG report looks like. Is it like that? All of you have seen? All of you have seen, I think. Okay. So actually there are four levels of PSG we do. Level 1, level 2, level 3 and level 4. In level 1, we measure 7 channels. What are the channels? We measure the EEG, we measure the EOG, we measure the EMG. Along with, there are flow channels, there are effort channels, there are ECG, and there is pulse oximeter. If all these channels are done in a lab in presence of a technician, then we call it a level 1. And if all these channels are done in absence of a technician, then it is called a level 2. In level 3, we measure a flow channel, effort channel, and pulse oximeter. And in level 4, we only measure a flow channel and 1 pulse oximeter. So in my presentation, I am going to discuss about how we should interpret a PSG report, a level 1 PSG report. Because there are many things that are hidden in a PSG report, and apart from obstructive sleep apnea, you can diagnose many disorders, or at least you can get hints of many disorders from a PSG report. So, what is PSG? PSG means polysomnography. So, poly is a Greek word, somnos is a Latin word, and graphy is again a Greek word. That means many sleep writing. It was first invented in way back 1974 in Stanford University by Holland, Dement and Rennell. And since then, it has undergone many modifications, and now the modern version is out here. So this is a typical raw data of a polysomnogram where we can see there are neurochannels and there are flow channels, effort channels, ECG, pulse oximeter, leg channels, body position, and at last the stages are given. And this is how a PSG report looks like. You can see hundreds of values here. So this is a whole PSG report according to the ASM standard. You can see hundreds of values. So what we do out of confusion, we just look into a single value, which is this one. But if you look into this value, we'll miss the whole picture. So we have to dissect this PSG report systematically. So how we see a PSG report? So if you can, if you have seen a PSG report, there are several sections in the PSG report. First, there is a patient identification section, then a sleep stage summary section, there is a respiratory summary section, there is a body position section, there is a heart rate summary section, then a oxygenation section, and followed by limb movement, oximetry data, and everything is there. And this is called the sleep hypnogram, which provides a panoramic view of the whole study at a glance. So first we have to start from the identification section.